Welcome to today's webinar on exploring healthcare savings through Medicare Advantage plans. My name is Mark Levine, and I am the Deputy Director of your New York State Association of Counties. Thank you for taking the time out of your day to participate in this timely webinar discussing healthcare savings. More and more counties are exploring Medicare Advantage plans for the retirees 65 and older that are still on their health insurance program. Last year, Broome County created a cooperative purchasing alliance with other counties and municipalities to leverage their purchasing power, reduce costs, and increase stability for retiree health coverage. This webinar will detail how the Broome County Purchasing Alliance has achieved an average annual savings of over 25% for participating counties and local governments, while providing better quality coverage and services for the retirees. By way of a little background here from the NYSAC perspective, we are always looking for programs and services that can either save counties money or help them operate more effectively and efficiently, or both. We have an insurance program with NYMER and a workers' compensation program with PERMA, a deferred comp program with Nationwide Retirement Services, and a P-card program with PFM. We have partnered with 3+1, who provides cash vest services for almost 25 counties. And in the healthcare space, we work with a New York-based pharmaceutical benefit manager, ProAct. And 2 years ago, we started the Municipal Healthcare Financing Collective, which was created as a stop-loss captive for self-insured counties. Several years ago, we started exploring the Medicare space for retirees over the age of 65, because it can provide substantial savings for counties that still insure these retirees in their plans. This year, Broome County asked us to learn more about their program, which includes 4 counties and several public entities and schools. It's a great program, and we wanted to share it with counties and towns and local governments who may be looking for a solution in this space. So we brought in the team that created the Broome County Purchasing Alliance to talk about the program and how counties can benefit from learning more and exploring the possibility of joining the alliance. Before we get started on the webinar today, I'd like to turn it over to Kate Pierce to provide some housekeeping comments. Kate.
Thank you, Mark. Just a couple of notes here. I just want all of the attendees to be aware that the webinar is being recorded, and a link to the recording will be posted on our website later this afternoon with a PDF of the slide deck. And you can find that on our website at nysac.org/webinars. If anyone has any questions for our presenters during the webinar, please refer to your webinar dashboard and type your questions under the Questions tab. We will address all questions during the Q&A process at the end of the presentation. Back to you, Mark.
Thank you very much, Kate. And I want to reiterate that you can type in questions that you have along the way, and we will take those all up after the presentation. Now I'd like to introduce our speakers for today. Doug Bullman is the president of the Statewide Purchasing Alliance of New York. Doug has 36 years in the insurance industry. He started the Statewide Purchasing Alliance of New York a few years ago to focus on designing, building, and managing cooperative purchasing alliances in the public sector. Last year, he worked with Broome County to develop this Medicare Advantage program. Since 1992, he has owned and operated the Bullman Agency, which provides employee benefits consulting, dental, disability, life, FSA, and voluntary benefit programs. He is past president of the Broome County Life Underwriters Association. Thank you, Doug, for being here. Joanne Wetzel is the vice president of client development for United Healthcare Group Retiree Solutions. Joanne works with customers, brokers, and consultants, providing information on Medicare basics and retiree solutions offered by their organization. With more than 30 years in the healthcare industry, Joanne has extensive experience in new sales, account management, member engagement, reporting, and various funding arrangements. Before joining United Healthcare, Joanne worked with other major carriers such as Cigna, Blue Cross Blue Shield, and other leadership roles. Joanne works with health plan channel partners, providing information that is necessary to successfully handle the unique needs of a retiree population. This requires staying current on Medicare laws and the changes that occur on an annual basis. We're pleased that Joanne was able to join us today. And our last presenter is Robin Labs, the Purchasing Director of Broome County. She was appointed the Purchasing Director in 2018 by County Executive Jason Garner. She has introduced legislation to bring best value procurement laws, local laws to Broome County, which allows the county to piggyback on national cooperative and other governmental agency contracts for commodities and services to save money and award more contracts locally. In 2021, she led Broome County Purchasing Alliance's RFP for Medicare Advantage and prescription drug program, which was awarded to United Healthcare. Thank you for being here, Robin and Joanne and Doug. At this time, I'd like to turn over the presentation to Doug Bowman.
Thank you, Mark. To start off, I'd like to give thanks to Jason Garner and his executive team, especially Robin Labs, for coordinating all of the purchasing directives that needed to be followed for this RFP. It wouldn't have been possible to do without them. Next page. Just to give you a little background of the pioneering, in 2017, we began to do a market check on Broome County's pharmacy benefits program. At that time, we found that there were 3 national alliances for pharmacy alliances that were very competitive with the program. And in the interest of minimizing disruption, we were able to use one of those national alliances, which had Express Scripts Inc., which was Keenan Associates. Through an affiliation with the Capital District BOCES, we were able to secure some shared service matching funds. I think we were one of the first groups to receive shared services on the pharmacy benefit by utilizing a national alliance. At the end of 2018, we implemented the program in May of 18. At the end of that year, we had about approximately 3.1 million in savings over that period, and were able to receive a matching check from countywide shared service initiatives of an additional 3.1 million. That's what put us on the path to creating this purchasing alliance. We did not want to create a cooperative where we would be sharing risk or sharing claims. In this particular instance, we were able to pool the purchasing power of municipalities in the state of New York without pooling claims or sharing risk, and achieve $9.1 million in premium savings across the alliance. Next slide. Through this purchasing alliance, we were able to cooperatively bring in 26 entities, and those entities pooled their purchasing power to come in and purchase their Medicare Advantage prescription drug programs through the alliance, creating an annual savings of 26% average across the board. And this was achieved through multi-year rate guarantees. Initially in 2022, January was the first starting of our alliance project. And over that 3-year rate guarantee from 22 to 23 to 24, we've seen an average of 26% savings across all entities participating in this alliance. Next slide. Here are some of the 2021 BCPA accomplishments. Broome County, we had actually done an RFP for them the year before we decided to create this alliance. That created about 1.9 million of savings in the 2-year with a 2-year rate guarantee, and the additional 840,000 is generated by the alliance itself. Chemung County was one of our big winners. Their total financial impact over 3 years of savings is just in excess of $3 million. Tioga County was another one of our big winners. Their total projected savings over the first 3 years of this program is $3.3 million. So there was some significant savings for all of our groups, but this will give you kind of an impact of what that first year savings would look like. For example, Chemung's savings was $2.3 million over that 3-year period, but with the addition of the 95% match of the shared service initiative, that added another $772,000 at the end of the first year. So essentially what's going to happen at the end of the first year, you're going to receive 2 years of savings, 1 year with your month-to-month savings, and then that 95% match on the countywide shared service initiative, making this program very attractive. Next slide. Standards of excellence. This program offers one of the top carriers in the industry, United Healthcare. United Healthcare has brought 3 plans to our alliance, and those plans are some of the top benefits that are offered throughout United Healthcare's portfolio. We also try to eliminate some disruption by using the most generous formulary offered in New York to prevent some of those potential drugs that are not covered, and any negative experiences by retirees running into a drug that's moved to a different tier or not covered altogether. We mentioned we're pooling purchasing power, not risk, and that power of that collective saved $9.1 million for the alliance total. The program has quality built in every aspect of it, from the quality of coverage being offered to the implementation, the onboarding, all of the transition from your existing carrier to United Healthcare will be handled by designated service teams. And those service teams were able to onboard all 26 of our entities without a glitch. Next slide. There are some participation requirements to be eligible to participate in this alliance. You must have a minimum of 25 Medicare primary retirees. You must have the obligation to provide this retiree coverage, either through collective bargaining or other agreements. And in some cases, we see that some municipalities have spouses that are also eligible. As long as that is in your obligation to provide this retiree coverage, they are eligible to participate in our program. Also, the employer must contribute a minimum of 50% of the premium cost of the MAPD plan. Participating groups must only offer one of the 3 programs that United Healthcare offers through the alliance. So groups should submit their richest plan design and match it up with either Plan 1, Plan 2, or Plan 3 when you submit your resolution to participate in the program. And it's important to know that when you decide that this program meets your minimum coverage requirements for your collective bargaining agreements and your retirees, you can submit a resolution, and your board must pass a resolution that says that you will be participating in the Broome County Purchasing Alliance effective 1/1/23. We have sample resolutions that you can use to pass, but really that resolution is the primary object that you need to submit into the portal through the statewide Purchasing Alliance website in order to be eligible for this pricing in this program January 1. Next slide. That resolution has to be submitted in the SPANY portal, spany.org, by August 1st of this year. And I know that's a tight deadline to meet, but many of our groups have already called special Zoom board meetings to pass the resolutions. Once you have your resolution, and there's 2 other items that you'll have to submit through the spany.org website. You'll have to submit a census, which includes date of birth, gender, and zip code of your retiree populace, and a copy of your richest plan design that we will be matching. So 3 items to submit through our portal. Passed resolution amongst your governing board to participate in the program, a census that includes date of birth, gender, and zip code. Remember, we do not need any claims experience, and a current summary plan description of your richest plan design that you currently offer. And all 3 of those items have to be uploaded in our portal by August 1st in order to be eligible to participate in the pricing and the plans of this program. Next slide. We mentioned that there's 3 plan designs. Joanne is going to go through on a very brief basis, go through the differences between the 3 plan designs. But I wanted to talk about a couple of things that are very important with respect to these plan designs. We know that disruption is of utmost importance to everyone that is on this webinar. So we designed it to eliminate any disruption amongst your current retirees. We also recognize that they have all day to tell you exactly what's wrong with the program that you've implemented. So we wanted to eliminate that up front. The first way we did it was through a national passive PPO provider network. What this is any doctor or facility that accepts Medicare and signs on with CMS is an in-network provider for us. So let's talk about that. If a retiree is currently seeing a doctor, then more than likely that doctor is accepting Medicare. So anytime you have a question as to whether a provider is participating or not participating, you can just check with the provider to see if they participate with Medicare. If they participate with Medicare, they are an in-network provider to us. Virtually 100% of the facilities participate with United Healthcare. The pharmacy formularies were designed to eliminate disruption amongst your retirees. They are the highest utilizers. So we used the most generous formulary, Formulary H, that's offered by United Healthcare in the state of New York. We also added a bonus list of drugs that are typically used by retirees, but not covered by Medicare. So we have a very extensive drug formulary and have had no complaints from any of the existing retirees that have come into the Alliance. Next slide. There are some additional benefits that are gained by that. Participating in this Alliance, smaller groups are not eligible for some of the larger group pricing that we're obtaining, nor are they eligible for some of the bonus coverages and provisions that are included in this program that Joanne is going to touch on. By reducing your premium, you may also reduce some of your GASB liabilities. As we mentioned before, the program is eligible for this countywide shared service initiative. So entities that are participating in this program that have first-year savings, you'll have to amend your countywide shared service initiative to include this project. You may also have to invite some school districts. If their school districts in your jurisdiction decide to participate in the program, we have some in Broome County that have come in. Those may have to be added to your shared service panel. As we also mentioned, United Healthcare provides dedicated service teams. They have implementation teams. They have onboarding teams that will set up your billing for each one of your entities. Teams that will do the implementation, the town hall meetings, the retiree meetings on location at at your facilities. All of those factors factor into the quality of this program to make sure that there are no mistakes being made, nobody slipping through the cracks. All retirees are added into the system, and that everything is handled smooth and professionally to make sure that the transition is as as harmless as possible. Excuse me. Next slide. We talked about some of the requirements on your behalf for the shared service initiative. The panel members must approve this initiative on your countywide shared service project before December 31st. Entities on the panel can opt out of this initiative. Towns, villages, and cities that are typically on your shared service panel, we have not had the opportunity to reach out to many of those. So at the end of this presentation, you may want to reach out to some of the members of your shared service panel to make them aware of that and have them reach out to us so that we can get this information in their hands. For additional information on what the requirements are for the shared service, you can go to this resource, Countywide Shared Service Initiatives, under the www.newyork.gov/shared-service-initiatives, and then go to forums and guidance for more resources. Next slide. Here are some deadlines. All resolutions must be submitted by 8/1 in order to be eligible to participate in the project. The account registration, again, is going to be on the spanny.org website. Account registration is used for setting up the billing for each one of the entities that is uploading their data into our system. 8/15, the communications and onboarding for all the entities coming into the Alliance will be completed. The dedicated service team managers will do the outreach to all the entities to set up the meetings, to coordinate the onboarding and the retiree on-site and virtual meetings. That happens between September 1st and December 15th. And then they will also do the coordination for all open enrollment meetings at that time. Next slide. Again, we talked about some of the aspects of the national PPO. I'm going to go through Plan 1, and then I'm going to turn it over to Joanne Wetzel from United Healthcare to go in more details on the program offerings of this plan. But to give you just an overview, most all medical services under our Plan 1 are covered at a zero copay. 100% of all generics are covered with a zero copay. There's a $5 brand and a $20 specialty and non-preferred brand drugs. There's 2 copays for 90-day supply at the retail pharmacy and 1 copay for 90-day supply mail order. The premium for this program is $260 a month, and that premium is locked in for 2023, and it has a maximum premium in 2024 of $275. Once we tally up the numbers of entities that are coming in and the volume of retirees in 2023, we will begin negotiations for the next 3-year block with United Healthcare. So those rate guarantees may be extended. We may have, we may have rate reductions. We may have rate increases. We won't know until we know just how many groups are going to come in to the Alliance and work with us to build the volume and leverage and purchasing power to negotiate those premiums. So with that, I would like to introduce Joanne Wetzel, who has been one of our advocates in getting this program off the ground, and she will discuss the program highlights. Thanks. Joanne?
Thank you, Doug. Good afternoon, everyone. And Kate, you can go ahead and switch over to the United Healthcare presentation. Beautiful. You can go one more. Excellent. All right, well, thank you everybody for joining us this afternoon. We appreciate your time and attention. I'm just going to go through some information on United Healthcare Retiree Solutions, just to give you a little bit of background on our track record and our performance and how we perform from a quality and financial stability perspective. So these are just a few of the organizations that trust us with the care of their retirees. I'm sure you recognize a lot of these names. This, of course, is not an exhaustive list of every client in New York. We just like to throw several out there that resonate with the audience. I work specifically in the public sector space, so I work with cities, towns, counties, villages, school districts, and higher ed clients. But I like to show this slide, and I refer to this slide as our credibility slide, because I think it's important for you to know some information about our history and our background. If you look at the numbers across the bottom of this slide, you'll see that we cover a really large retiree population in a wide array of products, from Medicare Advantage to Medicare Supplement to Part D, but we cover over 14 million members across the country. So not only have we been doing this for a long time, we have a strong track record from a client retention perspective. So not only have we been doing this for a long time, we're actually a pioneer in this space. We have over 40 years of experience with retiree programs, and we have stayed in the retiree space consecutively for those 40 years. So we didn't enter, leave, and then come back. We've been a steady force in the Medicare experience for those 40 plus years. And in those 40 plus years, we've really experienced strong growth, strong persistency. We actually serve 1 in every 3 Medicare beneficiaries across the country, which is a strong statistic. So not only do clients come to us, but clients stay with us, and that's validated by that 98% client retention rate that you see at the top of the slide. So I showed this slide because I think that this will help everyone that's attending today to have confidence when you're considering this program being offered through the Alliance. Next slide. So this slide speaks to our market leadership in this space. So we not only work with groups in the Medicare Advantage space, but we also work with individuals. We are a market leader in both. So with 40 years in the retiree space, you do gain a lot of experience, you gain a lot of knowledge. We're at that point where we've mastered the administration of these plans, and we've developed a really strong relationship with CMS, CMS being the Centers for Medicare and Medicaid Services. So we do a really great job of meeting the unique needs of a senior population, of an aging population. So everything that we do, everything that we build is all around taking care of a senior population. Even with our benefit enhancements that we build that I'll talk about in a little bit, all geared toward the senior aging population. And as a result of that, you know, we have basically become #1 in market share and have maintained that for several years in a row. And you really can't achieve that without taking excellent care of your customers. You will hear, and some of you on the webinar have probably already been with us through some implementations. Over and over, we hear that we make that transition easy. We do the heavy lifting, we give white glove service. But our mantra is positive experience. We want to create a positive experience for the retiree, and we want to create a positive experience for the employer group. And multiple touch points are required along the way in order to do that, and we have that down to a science. But I just think that this slide puts our growth into perspective. We have added over 1 million new members since 2014. That is 100% organic growth. None of that is a result of mergers or acquisitions. That's all pure organic growth. And I just think that this speaks volumes when it comes to who employers are choosing for their retiree solution. Next slide. So Doug talked about this a little bit earlier. I just want to touch on the network and just kind of the depth and breadth of the network, but also just the passive nature of the network. So UHC has the largest Medicare Advantage network of any Medicare Advantage carrier in the country. And you can see by this slide, we have a strong national presence, but we also have a very strong presence in New York, over 76,000 providers, over 164 facilities. So very strong in the state of New York. But as you know, retirees, when they retire, don't necessarily stay in their site of state. So many will move to other parts of the country, maybe to warmer climates, or maybe you just have snowbirds. The nice thing about this plan and the fact that it is a non-differential passive PPO, that retiree experience is going to be the same for that retiree no matter where they go. So this is a true national footprint, and by a true national footprint, I mean that it covers the entire US and all US territories. So the BCPA plan, or the Alliance plan, allows retirees to see allows retirees to see any provider that accepts Medicare, whether they're contracted with us or not. So these numbers you see in front of you today are just the participating providers. That doesn't count all of those other providers out there that accept Medicare that retiree can access for their care. And Doug said this before, but I'm going to say it again. This eliminates noise and disruption because your retirees are more than likely already seeing a provider that accepts Medicare. That means they get to keep their doctor. So they don't have that disruption of having to change primary care physicians or changing specialists or that sort of thing. They get to keep their doctor and continue to have matched or enhanced benefits. So this plan covers the retiree regardless of where they live and regardless of where they travel. So let's say they are snowbirds and they go south in the winter. They don't have to call in and say, hey, am I going to still be in the service area? If they're in the US, they're in the service area. And their experience in Florida or Arizona or California is going to be the exact same experience that they have when they're in New York. Same benefits in and out of network. There is no gatekeeper, no mother may I. You don't have to ask permission to go see a specialist. Basically, if they want to go see a specialist, they go straight to the specialist. They self-refer their care. So again, this makes for a very, very easy transition because their benefits are either going to be equal to or better than, and they're going to be maintaining their doctors. Going to that next slide. So being a high-performing carrier means that we can add a lot of benefit enhancements that are just baked in and automatically included in our plan design. So the first one I'm going to talk about is house calls. So you may say, well, what is house calls? House calls is exactly what it sounds like. It is a free in-home clinical visit where we spend 45 minutes to an hour, sometimes more, with the member doing a complete medical history, checking their medications, assessing their environment, making sure there aren't fall hazards, and closing gaps in care. We visit people at home, and many times we find out they have chronic conditions that they were not even aware of. We can set specialist appointments for them or get them back in front of their primary care physician if needed. But retirees love this in-home visit. Many don't have transportation to go to the doctor, so they love having the clinician come into their home. And I'll just mention here that 100% of the people, of the clinicians that are doing these house calls are W-2 employees of United Healthcare. We take this seriously. We were a pioneer in house calls. We do not contract this out. We do not lease this program out. Every single person that does house calls is a clinician that is an employee of United Healthcare. That creates consistency in the experience that every retiree receives when it comes to getting a house call. And then we also have what's called member rewards. We actually give gift cards to retirees for healthy behaviors. So let's say, for instance, they are due for a mammogram, or maybe it's time for their annual wellness visit, or maybe it's time for a colonoscopy, or maybe there's a certain screening that we want them to go and take care of because of a particular condition that they have. We will give them gift cards for doing that. So think about a retiree on a fixed income. Getting gift cards for things that they need to be doing anyway is a fantastic incentive, and this is really meaningful for the retiree population. And then we also have something called Renew Active. So this is a fitness benefit that provides a free gym membership. We have the largest national network of gyms across the country, And that member can go to any of those gyms as many times and as often as they want. So for example, they may want to go to one facility on Monday because they like the pool. They may want to go to a different facility on Wednesday because they like a particular group fitness class. They may want to go to a different gym on Friday because they meet their buddy there to work out together. So they can go to any of the gyms in the network, and the network is very expansive. But in addition to this being a free gym membership, it also includes things like brain health assessments, brain stimulation games, and also online coaching. So lots of things baked into Renew Active. And then moving on to podiatry. So this is routine podiatry that's above and beyond podiatry care that happens as a result of a medical condition. This is routine podiatry that's not typically covered on commercial plans. A lot of retirees are prone to foot conditions, and many retirees are just simply not in a position to be able to take care of their feet. Routine podiatry is included in these plans, and seniors love this benefit, and trust me, they take full advantage of this benefit. And then UHC hearing. So we have included in these plans a $500 hearing aid allowance. But what makes this even more special is the fact that we attach what we call the UHC hearing savings program to that allowance. So that savings program is up to 80% off, 80% off of the retail or industry standard pricing. So that actually makes the hearing aid affordable. So that $500 goes a long way when it's coupled with the UHC hearing savings plan. And then last but not least on the benefit enhancements is what we call UHC Healthy at Home. So this is a bundle of services that includes meals, transportation, and in-home personal care. This benefit resets after every single inpatient stay or skilled nursing facility stay. So a person will actually have meals delivered to their home, and those meals are specific to whatever medical condition they may have going on at the time. So for example, if they're diabetic, we're going to have low sugar food meals prepared for them. If they're hypertensive, we're going to make sure that they're low sodium meals. Maybe they need gluten-free. There's 9 different types of meals that can be delivered to their home. And this is important because what we have found is one of the hardest things about someone once they're released from an inpatient setting is getting them to eat nutritionally and healthily. And that's part of their recovery process and also part of keeping them from being readmitted to the hospital. So having meals delivered to the home makes it easy for that retiree to be able to engage in a nutritious meal and be able and more likely to eat that meal if it's being delivered to their home and that they don't have to prepare. The transportation gets them to follow-up care, and the in-home personal care helps them with things that they may need around the house. And then on the next slide, we're going to talk about star ratings. So star ratings are a big deal. CMS, the Centers for Medicare and Medicaid Services, actually identify high quality Medicare Advantage plans through what we call star ratings. So we take great pride in the fact that 100% of our group MA PPO members are in 5-star plans. We have been at 4 stars or higher since the inception of the program. That's really, really important because it feeds into what CMS reimburses you in subsequent years. So star ratings are important and they have financial implications for Medicare Advantage plans. And I just want to point out that we are the only major national carrier to have a CMS 5-star rating. And high star ratings translate into better pricing, and they also translate into more rate stability at renewal year over year. That's one of the reasons why we were able to start this and launch this program with a 3-year rate guarantee. We feel that confident because of our star ratings and how we have performed year over year over year. High star ratings equal financial stability. High star ratings also equal quality of care as well. So just want you to know that CMS has 43 different measures that they look at to determine your star rating. And you can't just get a high star rating and sit back on your laurels. You have to achieve that new star rating year over year over year. We have an entire team that does nothing but make sure that we're achieving these high star ratings to maintain quality and to maintain financial stability. So because of these consistent high star ratings, you on the webinar should be able to feel confident in not only the quality of care for the retirees, but also the financial stability of the plan in future years. And going to the last slide, I know that Doug talked about, there's 3 different plan designs. This is a very, very high level. It doesn't go into tons of detail, but it hits those things that retirees' eyes go to first when they're looking at a benefit summary. Across the top of this grid, you'll notice the medical benefits, and then the pharmacy benefits are across the bottom. I do want to go ahead and give you the pricing. It's not on the slide, but for those of you who want to write it down, as Doug said, Plan 1 is $260. Plan 2 is $240. Plan 3 is $227. So if you want to write those down, I'm going to mention them to you again. Plan 1 is $260. Plan 2 is $240. And Plan 3 is $227. Just to give you a few highlights that kind of stand out for me. Basically, the plans go in a continuum, with Plan 1 being the richest, Plan 2 being in the middle, and Plan 3 being the leanest. So kind of a high, medium, and low. All of the plans are very attractive. So, I hesitate to call them low, but just for the sake of comparison, just know that we're going in a continuum. Plan 1 being the richest, Plan 2 being next in line, Plan 3 being the follow-up to that. One thing that you'll note is that Plans 1 and 3 are identical from a medical perspective. So basically, all of the medical services for Plan 1 and 3 are going to be 100% coverage, 0 out of pocket. They're going to cover everything that Medicare covers and then some. So in addition to what Medicare covers. The only difference between those 2 plans are the pharmacy benefits. So 1 and 3, the same for medical, only difference is the pharmacy benefits. Plan 2 has some skin in the game, so to speak, for retirees. So Plan 2 has some co-pays, it has some co-insurance, but they're still very attractive from a benefit offering perspective. So not anything onerous, very nominal co-pays that are associated with Plan 2. I do want to point out that all 3 plans are quoted with our most robust formulary. Now, in addition to the most robust formulary, we also added a bonus drug list to this as well. There's full gap coverage that's associated with this, so there's no donut hole, it's full gap coverage. And the nice thing about this most robust formulary is that 100% of the generics are in Tier 1. A lot of formularies have different tiers of generics. They'll have a preferred generic, a non-preferred generic. This particular formulary puts 100% of the generics in Tier 1. The nice thing about that is that you're going to have either no copay whatsoever or a nominal $10 copay, depending on which plan that you're looking at. Even if it's a specialty generic, it's going to be in Tier 1. So any and all generics, 100% are in Tier 1. That's important. That way a retiree doesn't have any surprises when they go to the pharmacy and might find out on some other formularies that it might be a non-preferred generic. You don't have to worry about that at all with these plans. And then all 3 of these plans include all of those benefit enhancements that I just talked about. So the house calls, the fitness, the podiatry, the in-home meals and transportation, United Healthcare Hearing, all of those benefits are included in all 3 of these plans. And all 3 of the plans are quoted on that national passive PPO, which is a true national footprint where the benefits follow the retiree, and the retiree has the same experience in and out of network, no matter where they go in the US or all US territories, as long as they either use a United Healthcare provider or use a Medicare provider. Using a Medicare provider is exactly the same experience as if they had used a United Healthcare provider. And that's the conclusion of my portion of the presentation. I don't know if we're going to pass it off to Robin for any additional comments, or if we want to switch back over to Q&A. Mark or Robin? I'll
What
turn
I
it
thought
back
it would do is show the final slides with the Spanny.org website, talk about the broker program. We do have a broker program. So if you have a consultant or a broker that you're currently working with, you can continue to work with them. We'll just register them with Statewide Purchasing Alliance and bring them into our broker program so that you have continuity of care for your benefits and your retirees with your current broker. With that, I'd like to turn it back over to Mark and bring it up, open it up to questions and answers.
Thank you, Doug, and thank you, Joanne. We've heard about the Alliance and then about the benefits of the specific Medicare Advantage program with United Healthcare. I've got a couple of questions that have come in, and I'm going to get those rolling, but I want to remind the folks that are participating in today's webinar that you can, if you have a question, now's a good time to type that into the question panel on your screen. First question is, you covered a little bit about this, Joanne, but what coverage is there? Is there coverage, and what coverage is there for hearing, vision, and dental?
So the hearing is covered for all three plans, and all three plans include the hearing exam, and they also include the hearing aid allowance. These plans do not include supplemental dental or vision.
Okay, thank you. So,
oh no, I'm sorry. I need to correct that. I apologize. So there is no dental, that is correct. However, with the vision, there is a vision refraction that is included every 12 months. That is a $0 copay on plan 1 and 3 and a $10 copay on plan 2. But all three plans do include a vision hardware allowance, and that vision hardware allowance is the same among all three plans. It's a $70 allowance for eyeglasses or $105 for contact lenses. And that hardware allowance is every 24 months. So vision eye refraction and vision hardware allowance are both included, but a supplemental dental is not.
Great, thank you. And I'll do a quick plug for our partnership with the Health Economics Group, who's on the call today. We have a county dental network card program that those who are 65 and older can participate in. Actually, any member of your community can participate in. It's a low-cost dental network program where participants or holders of the card can pay what they would pay if they had dental insurance. So if you want to look at our website under the County Dental Network Card Program, there is that there. So that's a little segue, but back to Medicare Advantage. Doug, you talked a little bit about next steps. We have a question from participants. Is it possible for a group to participate with the program for a non-January 1 renewal? In other words, if they have their fiscal year or their health insurance year begins July 1 or a different, not January 1, is there a way for them to participate in this program?
That's a good question, and the answer is no. All effective dates have to be a January 1 in order to be able to be eligible for the shared service initiative. We also do that because of the way CMS rolls out the subsidies and rebates. So all plans have to be effective January 1.
So perhaps if a municipality doesn't have a January 1 start, they could write that into their program and do an 18-month or something like that, so that their next renewal would be a January 1 start. Is that an option?
Yeah, that definitely would be an option because, keep in mind, if they move into plan 1 or plan 3 where there's no medical copay, so there's no accumulators that we have to account for. where somebody has reached a portion of their deductible or co-insurance on their existing plan. Because we don't have that on our program, it would be eliminated if they came into, for example, Plan 1.
Great, thank you. So you talked a little bit about this. So for a January 1, 2023 start, what are the next steps that a county or municipality would have to do? It's June 27th now, so we have meetings, July board meetings coming up. What are the next steps that a county or municipality would have to go through in order to qualify to get a quote for the 2023 start?
Okay, we can provide quotes and full summary plan descriptions to everybody that's on this webinar. But other things to consider is if you have a board meeting scheduled for the month of July, you should definitely add on that agenda a sample resolution for participating in this program. If you have any interest in moving in this direction, that resolution has to be submitted through the portal through Statewide Purchasing Alliance prior to the 8/1 deadline, so that we can actually start your onboarding process and make it so that you're eligible to participate for January 1. So that's very important. They should get the resolution passed. If they don't have it on the board agenda for the next board meeting, they should add it. If they don't have a board meeting between now and 8/1, they should schedule a special meeting, either by Zoom or whatever their typical, meeting software is, and get that resolution passed at that special board meeting or at the next board meeting. Once that's done, it needs to be submitted in the portal along with that census and that copy of your plan design, your richest plan design.
Okay, great. And this has been recorded, so we will provide on our website a copy of that resolution right next to the PowerPoint slides and a link to where this recorded webinar will be stored. The next question is, what happens if dependents of the over 65 retirees are under 65? What happens to the dependents on that retiree's health plan?
That's a great question. With most of the groups that came in, for those groups that had that situation, those dependents were kept on the active plan until they reached age 65 and became Medicare primary. With the municipalities or entities that had the obligation to provide retiree spousal coverage, once that spouse turned 65, they're also eligible to come onto our program.
Great. Will the 8/1 submission deadline occur every year?
Yes. Yes, there'll always be an open window from May 1st to August 1st. And the reason why we do the cutoff at August 1st, even though our absolute drop dead deadline is August 15th, is so that we can get our implementation and onboarding teams set up, get the registration, account registration, and the billing information set up, and then do the outreach to each one of the entities so that they can do the implementation and enrollment meetings for those retirees.
Great. Thank you, Doug. And I want to thank everybody who participated in today's webinar. Thank you for joining us. And a special thanks to our panel, Doug Bowman from the Statewide Purchasing Alliance of New York, Joanne Wetzel from United Healthcare, and Robin Loves from Broome County. Thank you very much. Have a great day, everyone.
Thank you.
Thank you. Have a great one.